Dr. Darby Campbell here, and I just want to shoot this quick video on how spinal decompression therapy works and how it can benefit you and your spine. We have four major goals with decompression therapy. Number one, we want to get nutrition to the disc. And so a little bit about anatomy so you can understand. We have 24 bones of the spine. In between them, most of them, we have the shock absorber disc pad. And so that disc only has nutrition to the outside or blood flow to the outside of that disc. And so it needs to be moving in its full range of motion to get all that nutrition to the inside of the disc. And so step one with the adjustments is to get that bone back in the right position and get you moving it again. And then step two with the decompression is we start to traction that spine apart, and that creates a vacuum effect, pulling nutrition to the inside of that disc to keep it healthy and strong. This also pumps out the inflammation, which helps you get out of pain faster and reduces the swelling of the disc to help fast track your healing from disc bulges and herniations, which we'll get to in a second. And so secondarily with decompression therapy is when that bone gets stuck and it's not moving, a process begins we call degenerative disc disease. And this is where the disc pad in between the two bones is getting thinner and thinner and thinner as that disc desiccates or slowly starts to die and get thin. So what that looks like on a model is we have that more full thickness disc down to the more almost bone on bone. And so when we get to this state, unfortunately, there's not a lot we can do for you. This is very serious because you're usually in chronic pain at that point, and then that nerve hole is so small, there's almost always pressure on that nerve, and you're almost always having problems downstream to organs and muscles. Okay, and so we want to stop that degenerative disc disease process, and how we do that is by simply circulating that nutrition, and so that disc can stay healthy and strong, so that process doesn't continue to get worse. What brings in a lot of people as well too is when we get a disease or a trauma called slip disc, herniated or protruded disc. This dotted line here shows where the disc should be. The kind of red extension is showing a disc bulge or herniation. A view from the top of the spine will make a bit more sense in this, so let's shift over here. And so a normal disc is going to be along kind of that outside blue line and kind of that dotted line here. When we get a tear in the disc, the jelly that's on the inside can start to stick out and it'll start to create an extension of the disc, and that's called the protrusion or herniation. But again, when we traction that spine from top to bottom, we create a vacuum effect, pulling that fluid back to the middle where it should be, along with all the nutrition that we want as well too. And then that's going to reduce that bulge to get the pressure off that nerve, which is our fourth and ultimate goal. So number one, let's get nutrition in that disc again with the adjustments and the decompression. Number two, let's slow and stop that degenerative disc disease process if that's continuing in your spine. Third, let's reduce those disc bulges and herniations and stop them from growing larger. And fourth, let's get the pressure off that nerve so your body can feel and function its best, and all that power can get from the inside out. And you can do that without drugs or surgery in a fantastic way. Dr. Ashley and myself looking forward to going over the details of your case with you soon. So till then, bye for now.